Well, my name is Scott Robinson. I'm the Community Health Director for the Wewoka Indian Health Center. And I'm here to talk about the COVID statistics here in Oklahoma. And right now, our total for Oklahoma COVID-19 cases since January of 2020, 684,340. The total deaths since January of 2020 is 12,118. Right now, our 7-day average of new cases for COVID-19 in Oklahoma is 1,230 cases, and over 650 people are currently hospitalized here in Oklahoma. This pandemic is not over, and we need to be taking the highest precautions at this time here in our state. One of the things you can do, if you'd like to get vaccinated at the Wewoka Indian Health Center, we do have a number you can call. It's 405-257-7319. And we are currently vaccinating all people, regardless of race, and you're welcome to come to our clinic and be vaccinated. And COVID testing is for tribal members of federally recognized tribes, and the number to call for testing is 405-343-3108. Thank you.
Hi, my name is Dana Hayworth. I'm a nurse at the Wewoka Indian Health Clinic. I'm a captain in the United States Public Health Service. I'm the infection preventionist and employee health nurse there. We just want to talk a little bit about ways to prevent COVID-19 spread and to protect yourself and the community and your family members during the holidays. Right now in the United States, about 75% of all counties is experiencing high community spread of COVID-19. Right now, the dominant variant is the Delta variant of COVID-19. We're seeing some of the Omicron variant that's making its way here from Europe, and they're starting to see big surges there, so we anticipate that it will spread rapidly here. There are things we can do to prevent the spread and to slow down the transmission. And the number one way right now is still vaccinations. There's vaccines available for anyone the age of 5 and up now that are approved. So 5 to 12, there's a vaccine from Pfizer. And then 18 and over, we have Pfizer or Moderna vaccine at the Wewoka Indian Health Clinic. Just this week, it's been approved for boosters for our teenagers that are 16 and 17. So if you have a teenager that's been vaccinated the primary 2 doses and it's been 6 months, they can get a booster vaccine at the clinic, and then anyone over 18 can get a booster dose as long as it's been 6 months since your last dose. So that's the primary way to prevent the spread. Other ways during the holidays are to be what we call the 3 W's, practice the 3 W's of watch your distance, so 6 feet distance from people that you don't live with, that you don't normally associate with. The other W, wear a mask or a face covering, something that covers your nose and your mouth. It doesn't really, the virus is expelled through your mucous membrane, so if you cover your mouth but not your nose, you still have the possibility of spreading virus that way. So you need to make sure you cover your mouth and nose with a mask or a face covering. Also, washing your hands. Hand hygiene is crucial because anything you touch that someone else has touched, you can pick up viruses and bacteria that cause any type of disease. Hi, we want to talk a little bit about proper hand hygiene after the restroom, since we'll all be at families' houses and using the restroom with other people. So just a few tips wherever you're at for appropriate hand washing. If you have a sink with handles, you'll turn them on, get your soap, you'll have your running water. So you want to get enough soap to cause a good lather. And the appropriate time to wash your hands is 20 seconds. About the time it takes to sing happy birthday twice. So you want to get a good lather. You want to make sure that you get your thumbs, your wrists, all of your fingers and knuckles, the backs of your hands, between your fingers, and your nails. So you want to get soap in the palm of your hand and agitate that a while. The other side, and then with your running water, you want to make sure that you rinse thoroughly If you're wearing jewelry, move your jewelry around during the process to get under there so things don't harbor under your jewelry. Rings, bracelets, if you have watches that are down low. So you just want to rinse appropriately. Try not to be touching the sink up here when you're rinsing. Your water should be warm, not hot, not cold. If you get hot water, you're liable to get your hands irritated, especially in the cold weather, and get breaks or hangnails, things where germs can enter. So once you've rinsed appropriately, you want to make sure that you have, if you have a towel you're using at people's house, I would just recommend keeping fresh towels out for people so they don't have to reuse them during the holidays, where you can rinse bacteria off on those. So you want to get your paper towel. And you want to dry your hands thoroughly. I'm kind of a paper towel hog, so I'll get a couple. And you want to make sure you get everything dried well between your fingers. Kind of hold your hands up so that if any water runs, it runs down your wrists and not back onto your clean hands if your things run off your wrists where you may not have washed good. So you want to dispose of your towel. If you're in a restroom where you have to open the door, you want to use the towel, either if it's handles, turn the handles off. So leave that running while you dry your hands. Turn the handles off with the paper towel, and then you want to open the door as you leave with the paper towel, and then dispose of your dirty paper towel otherwise. I always keep hand sanitizer in my pocket. So after I leave the bathroom and get rid of my dirty paper towel, I sanitize my hands with hand sanitizer. Alcohol based, at least 70% alcohol. And just keep that in your pocket, especially during the holidays where you're going to be a lot of places where you're touching cabinets and dishes and people's furniture. Just sanitize your hands frequently. They can get dry, so make sure you use lotion, maybe in the morning and the evening to keep your hands soft and not get breaks and tears in those. So good hand hygiene. Don't recontaminate your hands on the faucets and the doors. Dispose of your paper towel, and then I go overboard and use some hand hygiene gel. Thank you. Other things during the holidays that are very important are to do social distancing as far as gatherings. You don't want to be in large gatherings with people, even if they're vaccinated, that you're not familiar with. You need to wear masks indoor at gatherings, especially in poorly ventilated areas where the virus can linger in the air and spread that way. You want to monitor your health, any signs or symptoms of COVID, which could be cough, shortness of breath, fever, even sneezing and congestion. A lot of people believe they have allergies flaring up, but those allergy symptoms could be COVID without other symptoms. So any type of gastrointestinal symptoms like nausea, vomiting, diarrhea, headaches, sore throat, any of those symptoms, you need to be watching yourself that you may have been exposed to COVID, even by people with no symptoms, because even vaccinated people with no symptoms can spread the disease to our elderly people, our people that have immune suppression from disease or medications. They're more likely to be infected with the virus even if vaccinated. So you have to put the measures in place to protect yourself, your family, and your community. Other things are cleaning in your household and your work area in areas that are touched commonly, like your desktops at home, your doorknobs, your sinks, your countertops. Just with any household cleaner in your homes are effective to prevent the spread. If you have someone ill in your home, you need to distance from them, and that would include your ill person preferably having their own room and bathroom, not coming to the common areas of your house to share meals. And for family members that aren't sick, to also wear masks to try to prevent the spread in your household. With the holidays, we want to be with our family, we want to be with our loved ones. It's our culture and our tradition to share those times and those meals. But we also have to protect our people. If you have to miss a gathering because you may be ill, that's better than, having an outbreak amongst your whole family member and hospitalizations or even possible death from the virus. You also want to test. If you have any, symptoms or if you feel like you've been exposed, testing is a good option. We offer testing at the clinic Monday through Friday when we're open. As Mr. Robinson said, there's a line you can call to get lined up for testing. And it's the Abbott rapid test. So you can get your test that day. We'll call you with results. We also partner with Southern Plains Tribal Health Board for contact tracing. So they're helping us to identify our positive patients and help get in contact with anyone they may have exposed to the disease so that they can quarantine, watch for symptoms, and try to prevent the spread that way. You hear a lot about the new variant, the Omicron variant that's in Europe, and it's now the dominant variant in the United Kingdom because of the widespread of it. And we have cases of that variant in the United States in 33 out of 50 states. So including Colorado and I believe Missouri and Arkansas around our states. So it's just a matter of time before, it's identified in our state. It's probably here already, just hasn't been, sequenced through the CDC yet. So regardless of it's the Delta variant, the Omicron variant, the things we just talked about to prevent spread and illness are the same. Hand washing, mask, watch your distance, and get tested and get your vaccine. So we want everyone to stay healthy during the holidays and enjoy your family as much as possible. We also want you to be safe so that our families around past the holidays also. So you can call the numbers that Mr. Robinson gave for the clinic for testing or for vaccines. And we are happy to provide those services to our community. And just any other questions you can call also. And happy holidays. Thank you, Madam.
Hello, everyone. We just want to remind everybody going into this holiday season to be mindful of the COVID-19 and do your part. Get vaccinated and vaccinate your children. Anybody who would like to get vaccinated can do so at Wewoka IHS from ages 5 on up. So please do your part, take care of your family, and be safe this holiday season. Thank you.
We're here at the executive office here in Wewoka, and Assistant Chief and myself would like to take this time to not only wish you a Merry Christmas, but also to meet safely during the holidays that's forthcoming. We have a great concern about the spread of the virus at this point. Many of the experts say that there will be a spike over the next 2 to 3 weeks, and we'll see that as families begin to gather for the holidays. So our concern is to have a conscience of caution and always be thinking about what you're doing. Many of you younger ones that will be visiting the elders, be of concern for those elders as well. Make sure that you're wearing a mask if you're meeting in close quarters. When you're washing your hands, make sure that things are sanitized so that people won't cross-contaminate, the areas where the sinks are and those things of that nature. Have a great time. Enjoy one another, but please be conscious of what the virus is still doing out throughout the United States and here at home within the Seminole Reservation.